In this video, today we'll be talking about the question conducting system of the heart, structure and function. Now, what is the conducting system of the heart? Like, what does it contain? It has like a collection of nodes and a specialized conduction group of cells that initiate and coordinate contraction of the heart. Now, something that's very interesting about the heart is it's said to be myogenic, meaning contractions are basically generated from the muscular tissue itself rather than nerve impulses, right? So you have nodes, okay, that will transfer impulses, right? So we'll talk about in the anatomy you'll talk about what all is present in the conducting system of the heart, right? So now we'll go to the structure. Again, you have your heart, right atrium, right ventricle, left ventricle. It's the two major important nodes are present in your right atrium. You have your sinoatrial node and your atrioventricular node, right? Now, your sinoatrial node is present in the terminal crest. The terminal crest is near it's it's near the opening of the superior vena cava, and you can see like a smooth and pectineous part, right? A smooth muscle area and a pectineous muscle area, and there's a crest sort of an area there. That's where you'll find your SA node. Now, from the SA node, you have three connections to your AV node, which is basically your internodal branches. You have three of them: anterior, middle, and posterior. Now, this is all there in your right atrium, right? So, what supplies the left atrium is bundles, okay, that goes from the SA node directly, right? Interatrial bundles, and they're called Bachmann's interatrial bundles. Okay. Now the next is your AV node. Your AV node is present in your Cox triangle. Now it's important to learn the borders of your Cox triangle. You have your septal cusp of your tricuspid valve. You have your opening of your coronary sinus. Okay, and you also have your Tudaro's tendon. Tudaro's tendon is where your superior vena cava and your inferior vena cava opens, right? Now, from the AV bundle, you have your bundle of His, okay, that kind of supplies to like the septum, or rather the membranous part of the septum, and then it divides into a right bundle branch and a left bundle branch, and each of these have smaller branches called Purkinje fibers that eventually supply like the myocardium. SA node is called the pacemaker cells because they're the most important in like regulating your heart rate. It's where the impulses start, right? Where is it present? You already spoke about it. Terminal crest, which is in the right upper corner of your right atrium. Now, there's two responses of the heart that you'll have to talk about: sympathetic and parasympathetic. What is sympathetic? Sympathetic is any reaction that your body gives when you're in a fight or flight situation, right? So, when you're in a fight or flight situation, your firing rate of the SA node increases because your heart rate increases when you are in that particular situation. Parasympathetic is rest and digest, and it decreases the firing rate of SA node and in turn decreases your heart rate. So the major heart rate, the major node that tells what your heart rate is or regulates what your heart rate is your SA node. Now, from the SA node, as we already spoke about, you have internodal branches that goes to your AV node, right? And the AV node is present in the Cox triangle. We spoke about the borders, septal cusp, openings of the coronary sinus, Tudaro's tendon, which is basically your inferior and superior vena cava opening. Now, from the AV node, you have bundle of His, right? And the bundle of His is kind of supplying to, and this AV bundle, right bundle branch, left bundle branch, all of the whole endocardial layer. Uh, then there's a question about cardiac wall arrangements, and there's a video on it as well. Over there, you'll talk about layers of the cardiac wall, and uh, you'll know that subendocardial layer is where your conduction system is, and the wall, the subendocardial layer of your ventricular walls has your Purkinje fibers. Now, sympathetic parasympathetic responses, we already know the difference between like the sympathetic and parasympathetic responses. What nerves give these responses? Sympathetic is given by our cardiac nerves, given from all cervical and a few thoracic sympathetic ganglion. Then your parasympathetic is given by the cardiac branch from the vagus nerve. Now the right vagus nerve supplies to the SA node and the left vagus nerve supplies to the AV node. Then you also have your cardiac plexus containing a superficial part and deep part. They're basically like a mixed sympathetic and parasympathetic plexus. The superficial part is below like the arc of aorta and in front of the right pulmonary artery, and it is formed by the superior cervical cardiac branch of your left sympathetic trunk and inferior cardiac branch of your left vagus nerve. Now, the deep part, it's your cervical ganglion of your sympathetic trunk and your cardiac branch of your right recurrent laryngeal nerve. What is this? Recurrent laryngeal nerve. Yeah. So that's it for this question.